Okay, so thank you, Rabbi. My name is Marc Wittenberg, as well as being a member of Borehamwood and Elstree Synagogue community. I'm also a consultant anaesthetist at the Royal Free in North London, which many people will know is one of the main COVID hubs for London. And so in the last few weeks, my job has changed significantly as it did back in the spring. So my normal role involves looking after patients having elective surgery or emergency surgery. But now myself and my department have been drafted in to support the effort looking after COVID patients. And so my role now is at the front line looking after the sickest and most critically ill of the patients coming in. So on a day-to-day basis, that means either being in the intensive care unit, looking after very, very sick patients, but we're also going out to the wards, to A&E, to stabilize critically ill patients that are deteriorating and need kind of further support. And many of the roles around the intensive care are very intensive, very resource heavy. So you may have heard of proning, where we're turning patients onto their tummies while they're on ventilators. So we get involved in lots of different tasks. And it's also meant that our normal kind of work pattern has changed. So we're now doing very long shifts, either days or nights. Of course, this is a 24/7 thing. So, you know, I'm working pretty much every weekend this month. So it's very difficult. So I think things have changed very, very quickly for us. This is much worse than it was in the spring for a number of reasons, which I can tell you about. But we kind of noticed in the middle of December that things were getting bad. Things were, you know, there was the lockdown in November, which reduced the numbers, and they were kind of grumbling along. And then very suddenly, a large volume of patients started coming in a very short space of time, and that's kind of this upward trajectory has just continued. And as a result, we've had to pretty much stop everything that we're doing. So pretty much all planned elective surgery and many kind of outpatient clinics have been cancelled, just to free up capacity and to free up the staff to help out where needed. So pretty much the whole hospital is now dedicated to treating COVID patients. So if I just give you an example from where I am in intensive care, our normal intensive care capacity. So intensive care, for those that don't know, is where we treat the sickest patients in the hospital, those patients on, you know, kind of commonly referred to as life support, ventilators. And these are patients normally who've got a mixture of diseases, but now it's almost all COVID. And we normally have a maximum of 32 intensive care patients in the hospital. At the last count, I think yesterday, we're up to 80. And so I think what's probably not explained well enough in the media is when we talk about capacity, we're constantly increasing capacity, and we're constantly creating capacity where it didn't exist before. So, you know, our recovery unit, which we normally use for looking after patients who just had operations, is now an intensive care unit. We've got 4 or 5 extra areas where we don't normally look after intensive care patients. And not only are there more patients than there were in the spring, there's also less staff. You know, we've got lots of staff isolating either for themselves or for their families. And so we've got a very large volume, a number of patients being looked after by less staff, less specialist staff. So we're having to call in help from wherever we can get it. So we've got medical students coming in to help us look after staff. We've got our surgical colleagues. You know, yesterday I was chatting to a nurse who normally works in the intensive care at Great Ormond Street looking after children, who's come across to help us. So lots and lots of people coming across. So it's a huge strain on the system. It's a huge strain on the staff looking after the patients. And at the moment we're right in the thick of it. It's very, very hard. It's emotionally hard. It's physically hard. obviously for the patients that we're looking after, they deteriorate very, very quickly, and it's, they're often very scared, they're very distressed. I am, and my colleagues are very often the last people to speak to patients before we have to put them to sleep and put them on ventilators to stabilize them, because they're deteriorating so quickly. Their oxygen levels are so low. And, you talk to these people who a week, 10 days ago, 2 weeks ago, were like, you and me, they were just getting on with their lives, and suddenly they're really at a very critical stage of their lives. It's also hard for the families. We do a lot of liaising with the families, and that's very distressing, because obviously the families can't be there by the bedside, and so they rely on the doctors and the nurses to communicate with them. We FaceTime a lot, and it's giving bad news over the phone, face to face is hard enough, but giving bad news kind of over the phone and FaceTime is really very difficult. So it's having a big impact on staff. There's no let up, there's no good news at the moment. So I certainly go home with a lot of the experiences that I've had during the day, and it's very difficult. I close my eyes at night, and it's difficult to kind of get some of the images out of my mind that I've been involved in during the day. And that's, as I say, this is not my normal day-to-day work. This is extraordinary. And at the moment, there's no let up. We've got patients come in every day. You've seen the pictures of the ambulances queuing outside A&E. The emergency department's constantly full, having to create space on the wards, having to create more beds. So we're running short of equipment, vital equipment that we need. So it's a very, very difficult time.
Oh, thank you so much for that insight. It's unimaginable what you're doing there and what you're having to face there. Do you have any sort of final message for people in terms of what they can do to protect themselves and to understand how serious the situation is at the moment?
It's hard, and I appreciate how difficult it is for people, and I appreciate that for me, I'm really exposed to it, so I can see how bad it is. But no one is safe at the moment. We're getting. It's not just elderly people who are being affected. It's I can tell you about patients in their 30s, 40s, 50s, 60s that I've been treating in the last few days who are really very, very severely ill. And the only way to get this virus down is to minimize social contact. And especially with this new variant, it appears to be incredibly infectious, much more infectious than what we were facing in March. And so people who were not maybe at risk last time of getting it, say you could go to the supermarket or be in a room with someone, you're now putting yourself at bigger risk. And unfortunately, there's no such thing as COVID secure. Whenever you have people gathering in a public place, like a shul or like a supermarket or anything, they're at risk, and it only takes one person, whether they've got symptoms or not, to inadvertently spread it. And it's devastating. It really is devastating. And I know from personal experience, I've got young children. It's really, really tough. Homeschooling is tough. Being isolated is really, really hard. But the only way to do so is to minimize social contact. So it's following the rules. We've now got a lockdown. No one wants it. No one, everyone thought that was going to be it last spring, and we're back where we are, or worse. And unfortunately, we're going to have to just ride this out. There is some good news, though, which is the vaccine. And so that's the second thing, is when you are offered the vaccine, take it. Why wouldn't you? There's so many scare stories. There's stuff going around the internet that most of it is rubbish. So, look at the trusted sources of information. This is the only way. Social distancing and the vaccine is the only way that we're going to get back to some kind of sense of normality.
Well, thank you so much again. That's really fascinating. It's really important that people hear what you have to say. Someone really at the cutting edge and the coalface and the front line Once again, thank you, and to all your colleagues. Hashem should bless the work of your hand and give you the strength to be able to carry out your vital work. You know, never before have we really realized how essential what you and all your colleagues in the NHS are doing. So thank you to everyone. Keep well, keep safe, and regards to your lovely family.
Thank you, Rabbi.